This week on the BackTable podcast.
I remember that moment when I was starting practice, when I, for the first time, saw patients through the whole experience, counseling, case, success afterwards, and that being a real big light bulb moment for me. And to see that happen in, a friend and our colleague who may have not got that opportunity otherwise, that is just as, if not even more gratifying to me than doing however many cases in a year. It's more gratifying than being invited to give any talk at SMS and that sort of thing, to see that fire and that excitement, and then to see her go and pass that on to other trainees that come through. That is really cool.
Hello everyone, and welcome back to BackTable Urology, your source for all things urology. You can find all episodes of our podcast on Apple, Spotify, YouTube, and on BackTable.com. This is Jose Silva is your host this week. We have a guest, Dr. Alex Tatem. Dr. Tatem graduated magna cum laude from University of Georgia in Athens, where he was a Hope Scholar, and he received his Bachelor in Science degree in Biochemistry and Molecular Biology. He earned his medical degree from the Medical College of Georgia in Augusta, Georgia, where he completed his internship in general surgery, followed by his residency in urology at Indiana University in Indianapolis, Indiana. He then elected to pursue advanced training with a fellowship in male fertility and microsurgery and sexual medicine at Baylor College of Medicine in Houston, Texas. He then returned to Indianapolis to help lead the Men's Health Center at Urology of Indiana. And furthermore, we have Kristen Gumpf. She received her bachelor's in behavioral health with a minor in psychology from Penn State University and her master's in physician assistant studies from Lock Haven University in Pennsylvania. Kristen started working in urology in 2015 with an emphasis in men's health and sexual medicine. She has dedicated her career to the field of sexual medicine and is a sought-after educator regarding her approach to the minimally invasive treatments of Peyronie's, has been part of the Men's Health Center of Urology at Urology of Indiana in 2022. Kristen and Alex, welcome to BackTable.
Thanks for having us.
Thanks, Jose. Happy to be here.
That was a very big introduction, but good.
The most shocking thing from that introduction, Jose, is I learned that we're getting old because, Kristen, that means that you've been here for almost 2 years now.
I know.
That's wild. That is wild.
So in this episode, we'll be discussing men's health and specifically more the APP function or how APPs can aid in men's health and in the ED or erectile dysfunction. So Alex, let's just start talking first with a little bit of how you came to be in your current practice. What were you, so when you finished your fellowship, what were you looking for when you started practice? I mean, what do you envision? Going to a academic center, for example, going to a hospital base, going to where you're setting that you were at now? What were you looking into?
Yeah. So when I was thinking about what I wanted my practice to look like, really, I was entirely focused on just doing men's health. I wanted to, pursue the pathologies and treat the patients that I had come to love to take care of during fellowship. And so, as much as I appreciated all the training that I got in general urology going through residency, I didn't want to do any of that. I went to a residency program where we did more RPLNDs for testis cancer than I did vasectomies. And so I, became passionate about an entirely different subset. And so I kind of quickly ruled out academics. I would most chairmen would probably see me as more of a liability than an asset. And, whenever I thought about like hospital employee, that just sounds like it's got a lot of rules. So private practice for me. And I was really attracted to Urology of Indiana because they really believed in the mission of men's health and having specialized urologists. They were very comfortable with that idea. They had a previous Larry Lipschultz fellow, a guy named Sam Thompson. When I joined, there was somebody else in the practice named Jason Kovac. And, they really wanted to, give me a shot. They didn't really care how I became productive or how I contributed to the practice. They were, as long as I made my numbers, then they're like, we support you. So I came here and made it my mission to do all men's health and nothing but, including prosthetic urology, male fertility, Peyronie's disease, and just hit the ground running.
And we have Kristen here, your current APP. And we'll get to that part into how you envision having an APP. Did you learn that from fellowship or you already had an idea? But Kristen, how did you got involved into men's health?
So I graduated from PA school in 2015, and so PA school training is obviously general. You can get a job in any specialty, and I didn't have a rotation in urology or anything. Really, more than anything, it was like getting out of school and looking for a job. And one of those jobs that I found happened to be in urology. And I think that's a pretty common experience for most APPs who work in urology, is like you just kind of accidentally end up in it. And I was like, okay, sounds good. It's a job, you know? And so I started into general urology. I was in Pittsburgh, Pennsylvania at the time. We were a smaller private practice. It was like 4 doctors and 4 PAs at the time. And it was like 9 months into my first year at that practice that I went to a PA conference. It's the Urologic Association of Physician Assistants. And there was a program. So it was about general urology, but there was a program about Peyronie's and treatment there, like with Xiaflex and everything. And we weren't offering it through our office at the time. And I definitely was looking for some kind of niche or just something that I could own in the practice to be kind of known for, to get patients referred. And so I went back to our practice and just kind of said, oh, I can start this. We're not doing it now, so might as well. And so I started that kind of from the ground up with Peyronie's program and Xiaflex program. And so that's what got me into it, just generally for sexual health, but I was still doing general urology. Honestly, it took like years and years until it got to the point that I went to SMSNA, the Sexual Medicine Society of North America, for the first time in 2021. And I was like, this is it. This is all I want to do is sexual medicine, and there's a whole big story kind of prior to that and after that. But, generally it was just getting that experience and having your eyes open to like, oh, you can specialize in this. So I was almost wondering when Dr. Tatum was talking, was like, at what point in time do you know that men's health, like in your training, do you know that men's health is something that you can?
I mean, I think it really depends on your training program. So I was in a residency that didn't have any men's health presence at the time. We had one fantastic reconstructive urologist who did, a really great job with his implants and his, sphincters, and we got that exposure. But as far as dealing with the stuff that we see every day, dealing with Peyronie's disease, with Xiaflex, the latest and greatest, like, testosterone formulations, male fertility, that didn't exist. And so, for me, I was really first exposed when I started studying for the in-service exam. And I actually really enjoyed studying fertility while all my classmates kind of, groaned about it. And I had the opportunity to, kind of step outside the norms of practice. And I used some research time to go spend a month with Bob Brannigan up at Northwestern in Chicago. It's not really mandated that you get exposure, which is what I think you're getting at. Like, if you happen to see it, you're lucky, and, hopefully it resonates with you. But otherwise, who knows?
And Kristen, to your point, I think that's the experience of more residency, just that you are doing maybe some sphincters, some IPPs, but really you're not, unless you have a very good fellowship program there, that you're getting the full immersion in sexual medicine. But if not, you're doing IPPs, and then if you like it, then you will pursue the fellowship.
I was going to say something that stuck out to me, which is a memory that is kind of burned in my mind, is I remember seeing Paul Perito's first video that he had uploaded to YouTube showing like a 15, 20-minute IPP. And I had never seen an infrapubic IPP before. And I had certainly never seen, it deployed that quickly. And so I remember walking into the OR the very next day as a PGY2, trying to hype my staff up like, oh, yeah, no, if we do it this way, you can just do it in 20 minutes. And I tried to do the rapid inflation like technique with the Boston pump, which, by the way, don't do that. It's not made that way. The MS pump is not made that way. And I was just so excited about what I had seen. And my staff had to tell me to, hey, go sit in the corner over there until you calm down a little bit. So it's funny. I think that we're seeing more and more interest in men's health as time goes on because there's more and more access. Like you can listen to podcasts like this, you can watch videos online. We've got people like even in the female sexual dysfunction place, like Rachel Rubin, who have been, putting a lot of really great content out there, getting young urologists and young mid-levels exposed to this.
Yeah, that's completely right. I mean, and for example, for me, I got involved or I was doing a lot of IPPs. I stopped doing them just for logistics in the hospital. But it's something that I love. And at some point, I was thinking about doing the fellowship, but I also like stones, I like BPH. And I think if you're going to go into this, you have to dive like you're doing, Alex. Immerse yourself into this. Because if you start doing just 1 or 2 IPP a week, then you're not going to be the guy. So if you go into this, you have to be that person in your area. And you have the volume, and that creates less side effects or less better results and all that. So, and like Alex, like right now you're in the big group and you're the guy, right?
Yeah. It's me, and I've got one other partner who does some IPPs and AUSs but he also happens to be our practice president. So he's pretty darn busy. I don't know. I'm lucky. I'm the guy, and I enjoy being able to contribute to the group in the larger sense, right? Like I enjoy being able to bring that really high level care to, Indianapolis, which nobody ever thought that you could have a high volume practice in Indianapolis, which is hilarious because this is where John Mulcahy started back in the day. But, people said that it would take us a couple of years, or take me a couple of years before I got busy enough to do only men's health. They said that, you got to do general urology, and then you slowly kind of inch your way into your specialty. And I said, no. Like I'm closing myself off day one. I'm not going to see any BPH, any elevated PSAs, none of that. I'm going to see only men's health. And then, even during my first year, which was COVID, I think I did 50 IPPs that first year. And then, it's just been up and up from there. We're going to do over 300 something prosthetic cases, this year. Pretty soon, after about a year or two, I was like, holy crap, I need help. And like, I am drowning. This is a problem. That's about the same time I met Kristen.
Yeah. It's crazy to think that like COVID was your first year so you were just getting started, and for me I was like on my way out when COVID hit. I mean, it was terrible, but that's crazy to think of. Just seems like it was just yesterday, COVID.
So Alex, so you mentioned you need help, and then so how do you envision the use of an APP?
I think one of the reasons that our collaboration and our model has been so successful is because I had no template. I had no earthly idea when Kristen came to join, because we already had 2 APPs in our practice that had really followed more of a office-based kind of refill testosterone, give trimix and that sort of thing. And, maybe every now and again refer a patient, for, consideration for an implant. And they're fantastic. Chris and Kyle are, awesome guys. And I've been I've been privileged to work with them for a couple of years. But when Kristen came on board, she brought a really unique expertise in XIAFLEX, having done that for a number of years at her previous practice. And so we really, we're focused on, what procedures can we get her doing? How can we keep her engaged? And, I just asked her, every single day, I think I asked her for the first 2-3 months when she was attached to my hip because we couldn't get the payers to credential her. I was like, what do you want to do? Did you have fun today? Do you want to do more of that? Cool. Let's do that.
It's nice to have that, like that somebody cares though, like, what do you want to do? And being open to it. That's a big deal. It seems so simple, but.
And Kristen, you mentioned you started doing Peronis back in the other practice when all your urologist was doing it. So part of, for you doing the jump into fully men's health, that's part of what you're looking for to be able to continue building your own practice aside along a urologist, or what are you looking for as an APP?
Yeah. So if we rewind back to 2020 and COVID and everything, I really got, it was dark times, especially working in medicine. And I got to the point where I was just done. I hated it. I didn't want to be a PA anymore. I didn't want to be in medicine. I had actually applied for 2 other jobs the same month that I went to SMSNA for the first time, and that was in October of 2021, and then got there and totally just life-changing experience. Again, like, meeting other people. I did, like, a men's health summit before the conference that year and met APPs from all over the country that I'm still friends with that, also work in this space. And so we talk about this a lot of times that, yeah, it just felt like I was on an island previously and just didn't have that great collaboration. And so when like going to the summit and then going to the conference, I just realized that that's how I was working. I didn't really know that before that experience. And then, the conference was great. So at the summit, it was Dr. Tatum's co-fellow who was there kind of talking to the APPs. And so I met Dr. Balin. And so then I met Dr. Tatum. I mean, you meet so many people at these conferences that this is their life, that they're doing so much sexual health. And I was just like mind blown. And so I went back to my practice in Pittsburgh and I was trying to specialize more in just sexual health. Like, that's all I wanted to do. And I was doing males and females, but it just wasn't working out at that. It's still wanting me to do general urology. And I just didn't have that passion. I wanted to do sexual health. And so, kind of jump forward a year later, I had heard through the grapevine that Dr. Tatum was hiring. And so I reached out to him saying, "Hey, I met you briefly at SMS. I don't know if you remember me, but
I,
can
w-
I
I,
come
I met
go
you
ahead."
briefly at SMS and a lazy river.
Specifically at the pool. But so I was like, "Can I come shadow you?" And he said, "Yeah." I came out and shadowed him. In the end, I was like, "No, I just want to ask for a job," pretty much. And so luckily that worked out and moved out to Indianapolis. I didn't know anybody. I just kind of picked up and made the move because at that point in time, I just knew what I wanted to do. And I never thought I was going to be that person who knew what I wanted to do or was passionate about it. I always thought that I was just going to work to have a job. And it just completely changed, going through that experience. And so moved out in November of 2022 and started with Urology of Indiana. So I definitely was looking for the collaboration, looking to be a part of building something. So the Men's Health Center was already here, but still being able to add to that, add new things, and work with somebody who was really trying to push and do more. And that's definitely, where I ended up.
So Alex, when Kristen comes in, I mean, what do you have planned for her? I mean, you mentioned, so it's just what do you want to do, but you probably had an idea of how the flow of the office. I mean, or do you have, or for example, my question, I guess, is in fellowship training, do you had an experience with an APP before? Do you envision what you wanted in the office?
Yeah. So when I was in fellowship, we did have a PA who worked with Dr. Lipschultz. Todd, he was fantastic. But he really was filling the same role that both Chris and Kyle were already filling in the practice. And I kind of saw that as that's the model. In men's health, you bring on a mid-level provider and, they will maybe occasionally see some patients that you've operated on like far in the past. Maybe they'll do, I heard that's who you should send your pump teaching to. That never happened in our practice. This is the individual who, just manages the testosterone or the non-surgical patients that, you still need to be seen. But as a surgeon, that frees you up to see more surgical patients. And that was kind of the paradigm we had been operating in prior to Kristen joining us. But then what happened is, Kristen came on board. I knew that I wanted to give her, ownership and leadership over our Peyronie's program with Xiaflex, but that was about it. And she was really stuck with me for a long time because, again, it took several months before we got her credential all the payers. And kind of slowly as time, went on, we kind of saw this role, this new role, this kind of reimagining of what an APP looks like in men's health kind of, unveil itself. And, I sat down one day and I was like, okay, Like, what can I do? Like, what is the limit of my license as a physician? And then what is the limit of Kristen's license as a mid-level provider here in the state of Indiana? And we went through it, and I was like, oh my gosh, like literally, if you're looking at counseling patients, signing them up for surgery, administering medications, injections, Testapel, all this, like the only thing that I can do that Kristen can't is be lead surgeon on an OR case. That is it. Vasectomies, she can do that. Sperm retrievals in the office, she can do that. Like, there is no limit. So really at that point, if there's no legal limit to it, the only limitation is her training, interest, comfort level. That's it. And her interest there, done. Like, the moment we stepped into the operating room together, she got bit by the bug. She was walking out our first day at a surgery center, and I kind of asked her, she was like kind of like vibrating with energy. She was so excited. And I was like, is this fun? Did you like this? Do you want to do more of this? And she's like, oh yeah, absolutely. And so, at that point, really the rate limiting factor was me. How much can I teach her? Okay. How comfortable am I, letting her do those things? How can we make it work logistically? And so at that point, we crafted her schedule so that she is not just in the clinic, but she's in the clinic running her own schedule, seeing her own patients. We don't really believe in the billing, incident to the doctor that's there. She bills on her own. She is independent, sees her own patients. She is coming with me to the operating room, not every day, but for, as many days as it makes sense. And she's doing these complex prosthetic cases with me. And the reason why that is so high yield is because even though technically on a piece of paper, you can say, my APP is going to make more money for the practice being in the office than being with me in surgery. I don't need an APP in surgery with me. What that does is it gives her such a deep and profound understanding of these devices and these solutions for patients. She's seeing these patients in the pre-op stage because they're her patients. She counsels them. She signs them up for surgery. We do the surgery together, and then she sees them afterwards. She's actually getting more throughput, more data and experience than most residents get, because residents don't have the benefit of seeing the pre-op, intra-op, and post-op. That's not how training is structured. And so now she's empowered when she goes into clinic to really, advocate for these treatments that we offer at a very, very high level. And so she's like, no, this isn't just Dr. Tatum, on a crazy rant. Like, really, like, our IPPs only take like 22, 24 minutes, and guys go home the same day and don't need narcotics. Like, I promise. And patients are hearing it from multiple professionals who are involved in it. So they become increasingly confident. And so that, a time in the OR in reality pays itself in dividends, on the back end.
And Kristen, what do you tell the patient? I'm going to see you. Then I have my tech, Dr. Tatum. He will do the procedure, and then I'll make sure that everything's working. How does that conversation goes?
Yeah, wait, about that too. What do you have a patient the other day who was like, if you're Kristen's boss, then I trust you. Like,
yeah, that was a phrase that was said to me. And I was like, all right, great,
So it's fun. That's how what I'm becoming in my office. I'm just Becky. She's my APP, and I'm becoming her tech.
I prefer the term PAA. I'm the assistant to the physician assistant.
Okay.
Associate.
Yeah, I mean, it's just, I have all the same conversations, maybe in different ways than Dr. Tatum. We're different people and we communicate differently. It has definitely changed pre-op and post-op counseling for patients, just understanding it from start to finish. Because I used to talk about these procedures, in my old practice, some. And I really would just kind of generally talk about it or, be very superficial because I didn't understand it fully. And there's a lot of nuance. There's so many, tiny things that could be different, patient to patient or case to case. And so it definitely has helped me understand that more. And, patients will ask specific questions and I'm able to give them specific answers. If it's pre-op, I love it. I've become a lot more comfortable having those conversations and then signing them up for a procedure that, again, I feel comfortable, the patient feels comfortable. The actual procedure part of surgery is fun, in the end it's different than clinic, and it's nice to kind of have that mix of things. But then, yeah, seeing the patients post-op again, it just brings it full circle. And I do think it's helpful for the patients to see, kind of the same person beginning to end and not somebody different every time that they're there and everything.
Patients don't want to see this every time they come in the office, pointing at my face here. Like, They're much happier when they're like, am I seeing Dr. Tatum or Kristen? Oh, okay.
Nah, and in my case, for example, I mean, they're going to get 5 minutes from me. They're going to get 20, 30 from the PA. And that's also something that they see, hey, they're going to sit down with my PA and they're going to know my PA, just like she goes to the OR sometimes just to learn from the procedure. I don't do a lot of endoscopy, so it's not like she needs to be there assisting me, but it's for her to learn and to have a better explanation to the patient. Hey, everything's going to be fine. Don't worry. That's what he does. So, yeah.
Yeah, and it's from an APP standpoint too. To be honest, there's times where if you're just seeing patients post-op, sometimes you get caught up in the post-op complications, that are bound to happen, right? But whenever you're not involved in all of it, it's very easy to be like annoyed of a complication or something because in the end it's because you don't understand all of it versus I have definitely come to appreciate all of those post-op complications that may happen and why they happen. And that I don't I don't get annoyed.
Now, to be clear, we don't actually have post-op complications in our practice, but if we did.
No, it's normal stuff, but it's just it can be really easy to almost try to, I don't know, let it affect you if you don't understand it, that you're annoyed at the surgeon or you're annoyed, by what you're seeing. But I think in the end, it's just because you don't understand it. And so for me, understanding it, yeah, it might be something super mundane. And then in the end, I can just pass that on to the patient and be like, oh, yeah, it's just this.
And quick Kristen question, I mean, from going back to 2015 as a PA newly grad, how do you saw yourself eventually evolving as a PA? I mean, were you going to be like in some practices, you're just seeing the follow-ups or the patients during the glow period, a scribe
I
for
had
a...
no clue.
Okay.
Yeah. Like, and again, I think that kind of goes back to school and training to some extent. I never had super specific training on like, this is what you could do. This is, I don't know. Yeah, I think in the end, I was mostly just thinking about being in clinic. I loved the OR, before, in school. I almost took a general surgery job. And so I always really liked procedures and surgery specifically. And, so at one point in time being in urology, I was looking at just doing inpatient first assist jobs. But no, I think in the end, I just kind of went with the flow and figured things out over time as far as what's even possible for a PA to do. I don't know. Yeah, you just don't necessarily know that. I hope in school maybe they teach it a little bit more now. And like I'm very passionate about passing that on to PAs, during training to say like, oh yeah, this exists. Men's health exists.
Yeah, but it's funny that you guys don't know, because we don't know. I mean, just like Alex said, I mean, we need to check what I mean, in my case, Florida says about what you guys can do. But we don't know. I mean, we just go by what this is. And it's funny that you guys don't know either. I mean, it's just, let's see what happens.
No one knows. Yeah. So, but it's funny too, going back to coming to Indianapolis, I just continue learning every day to speak up for myself because I wanted to do surgery before I came here. And I didn't say that. I was just going to accept being in clinic. And thankfully, that opportunity arose. But that's also just, you got to speak up.
Good. So, and Alex, I mean, how has it been for you? I mean, are you having more time in the OR now with Kristen there?
Yeah, I'll tell you. I mean, my rate limiting factor right now is not, it's really just OR and anesthesia availability. I could spend as much time as I wanted in the operating room if I really wanted to lean hard on that side of things. Right now I'm about 50-50 as far as clinic and the OR. And we're going to be we're building a new surgery center coming this January that'll be opening its doors, which will be fantastic, be able to expand access to care for a lot of guys. New office, so we'll finally be in an office that fits all of us. Kristen was afraid she's on an island, and then I brought her here, and now she's in a shoebox. But what I have found is an exponential increase in my my satisfaction at work. My work-life balance has actually gotten a lot better because now I have a partner who, truly, Kristen, again, she is, she's a PA, sure, but she truly is my partner in my job. She's the person that, I call whenever we need to make a, big decision about the men's health center. I need to bounce something off of somebody. I do my best to keep those calls within business hours usually, but having that sort of, collaboration and backup has allowed us to, grow so much more. And so I think that if a lot of people get really protective about like, oh, I want to do, all of my Xiaflex injections. Like I want to do this, or I want to see this patient and I only I can see my post-ops and that sort of thing. And really what you're doing is you're limiting yourself, and you're also limiting things for your patients, because your patients, like, dude, you're not going to, one thing that my dad taught me is that no man is an island. All right. Like we are all connected with each other. And if you try to go it alone, then you're the only person you're cheating is, usually yourself, but now you're also cheating all your patients too. So I think that I offer much better care. And, it is not just a top-down relationship where I just say, hey, this is what's going on, and that's how it is. I get lots of feedback on my performance. And, I also I get input, like we're doing a tricky case and, I ask, Kristen, hey, when we tried this last time, what did you think of how that patient did post-op? Should we zig when we should have zagged? She's giving me pointers on my pre-op counseling. She's like, hey, we're noticing, like, for example, the slings get like kind of this weird numbness over their scrotum. But it's not a big deal. It goes away, but they get real nervous about it if you don't tell them that ahead of time. We've noticed that maybe, Dr. Tatem, you shouldn't tell the patients, or you shouldn't imply that they'll have no pain, because they are walking around like a cowboy walk for a little bit. I'm like, I've never said that. And she's like, I have you on tape. But
Roll the tape.
yeah, exactly. And Exhibit A shows what's a lie. So, no, I mean, my long-winded answer to your question, Jose, but my practice, my quality of life, the care our patients received has increased exponentially.
No, that's awesome. And Kristen, how about you? I mean, definitely you're happy. Currently in the office, you're doing Xiaflex. What else are you doing in the office in terms of procedure-wise?
Yeah, so specifically for procedures, Xiaflex probably the majority, ICI teaching and whatnot. Along those lines, though, our nurses in the Men's Health Center are a huge piece of the puzzle, too, because they do, nursing visits for ICI teaching, and they do pump teaching. That even helps drastically, that I'm able to see patients while they're doing some post-op visits and pump teachings and everything. But then I see, patients post-op from their implants and everything too, to kind of review pump teaching, AUS activations. What else? Oh, cosmetic girth enhancement in the office too.
Yeah.
So yeah, definitely fan of procedures. What else do I do?
I mean, well, you may not know this, but you're doing my Tessa first thing tomorrow morning. So
Oh yeah.
not my personal Tessa.
Your patient's Tessa.
The patient that's on the books. Okay. I'm very happy with my vasectomy.
Kristen, you've been there for 2 years. And Alex, I mean, how did it first started in terms of, I know that there was nothing clear, but how you started to learn? It was, at first you were just shadowing Dr. Tatem, and then eventually it evolved into you start seeing patients on your own. I know you had some background in Xiaflex.
It was kind of interesting changing jobs too. So, I mean, my previous job, that was my first job out of school. I did that for like 7.5 years and then moved, and it was still in urology, but just specifically men's health. And so, of course, like there was a lot that I knew, or I thought I knew, right? But there was probably more than I anticipated learning whenever this is all that you're doing, so you're getting into the nitty gritty of testosterone replacement and implants and, post-op visits and sphincters and slings. And I had far less experience with incontinence care. So yeah, still a lot of learning there. But so like Dr. Tatum said, I had to get my Indiana state license, and then you have to be approved through all the insurance payers to see patients. And it took a good probably 4 months, and it was an interesting change because I went from seeing patients every day at my old job to shadowing. And that can always kind of wear on you or get old, right? But in the end, it was a lot to still learn. So I was shadowing Dr. Tatum and then the other APPs in the Men's Health Center. And It's just always good to keep learning because you see how different people do things. Even though we're seeing all the same patients, there's, maybe different routes to get to the same ending. But yeah, just tidbits here and there, talking about hormone replacement or whatnot. So, and, doing a lot of shadowing in the OR and for other procedures and everything. So, yeah, shadowing for like 4 months. And then as soon as you start getting approved with payers, they start adding those patients onto your schedule and everything. And then it grew quickly, to a full schedule or over a full schedule.
Yeah, it was all or nothing.
Yeah.
And Alex, in terms of testosterone, have you been doing less and then let Kristen do more?
Yeah, I mean, it's interesting that at first that was the transition, right? Where I saw less and less testosterone and, non-surgical patients. And Kristen was seeing, those patients. But now what we've noticed is that we've had, probably the next iteration of that where, we have now expanded our PA team. Something that I think Kristen mentioned earlier is that, we're very passionate about education. We had last year, we had our first year of our fellowship that was, funded through a generous grant by Endo to help train a brand new PA grad who joined us. Her name is, China Cuellar. She's absolutely fantastic. Shout out to China. And, she's now starting and she's seeing her own patients after spending, a 3-month and then some fellowship with Kristen, learning how Kristen does what she does. And now what's happening is Kristen is seeing mostly surgical and procedural patients that she's teeing up, for me. And, our hope is to really continue not just kind of growing the practice, but also growing like our commitment to education. Because as of right now, both myself and Kristen both have training programs sponsored through Boston Scientific, where if a surgeon wants to come and he wants to do a day with, 6, 7 IPPs, AUSs, and slings, he can do that. And it's a 2-day training experience, so that way they can see the office. But, Kristen now offers that for mid-level providers for the very first time. It's never been done before, but she's been doing it for about a year now, where mid-levels can come, follow her in clinic, look to see what an APP can really do when pushed to we're allowed to fly, as high as they can. And then they come to us in the operating room and we do cases all together. We're, in the midst of, through another grant application cycle, trying to do the fellowship again this next year through a sponsorship with a local university, Butler University. And, our goal is to try to kind of evangelize, this team approach to men's health.
And Kristen, those mid-levels that go to the office, what's their usual situation? I mean, were they like in your old previous job, or are they looking for the next step? I mean, what have you seen?
Yeah, mostly, general urology, but with some kind of focus in sexual health. And whether they are working with a physician who's doing prosthetics. But yeah, usually still a mix of, I don't think anybody else has come to a training program who specifically works just in a men's health center. It's a mix of some things. And yeah, so they'll come and do training in clinic and OR. And again, just kind of trying to expand upon the understanding, from a surgical standpoint. And I just really had that like light bulb moment whenever I went to SMS in 2021. And I see that in other people too, whenever they're experiencing these things. And so it's really cool, seeing that and seeing the excitement and having them take that back to their patients, because it really leads to better care too. Whenever you like what you do, you take better care of patients, you care about what you do, and in this space too, I think it's not everybody can have these conversations with patients. It's not always second nature, easy, and it doesn't matter what gender you are, because people will say, well, do guys, want to talk to a male provider instead? And I've seen plenty of male providers who aren't very comfortable having these conversations. So it's not that. It's just if you're comfortable having these conversations with patients, you almost like owe it to them to be in this space. I almost feel like it's a calling, that if you can talk about this stuff, then that's where you belong.
No, that's awesome what you guys are doing. And Alex, I mean, so you mentioned you have the program. So you said you added one more APP to your program?
Yeah, so right now we have 4 APPs on our team. There's Kristen China, who completed our fellowship last year, and also Chris and Kyle, still plugging away, working, taking care of patients. And we are, actively looking to, do another fellowship and open up another spot to add to the team. So, and I've interviewed a potential MD partner for the first time in a while, a couple of weeks ago. And so the program's continuing to grow. And my vision for, our men's health program here is, I've never been interested in like being LeBron James or being like the guy to do the most number of implants, possible. Although I do want to do the most number of implants possible. I am so passionate about prosthetic urology. It gets me so excited. And, really, I mean, like we do, a regular, 20 something minute, penile implant with no narcotics. And the guy is, home the same day using his device in 3 weeks. I mean, that is really fantastic. And we do that, 6, 7 times a day. I'm extremely proud of our outcomes. But what I'm more proud of than trying to, seek to push that number higher and higher is the team that we built. This is truly is a team. This is the Urology of Indiana Men's Health Center team. And I want people to love their work. I want people to love their coworkers, love their patients, and just, be excited when they go into work every day and to know that they have coworkers who share that passion and, consider them to be, friends, part of this dysfunctional family we call the Men's Health Center, and, people who will advocate for them and want to see them continue to grow and perfect their skills.
And Alex, I mean, you've been there for 4 or 5 years now. When you started, and you mentioned it was COVID, but how did you start promoting yourself in the area, saying, hey, I'm here? I know you have your partners, all that. You started getting feed by the other urologists. But in terms of do you use a lot of social media? How do you start to get the word out?
Yeah. So, I mean, both you and me, and Kristen as well, I have a mutual friend in, Clavel, and, me and Jonathan, we talk all the time about how we kind of sought to make ourselves known. And, me and Clavel took different paths because we're in different practices and, different environments. So I did do social media, started a YouTube channel. I think we got like 30,000, subscribers, published a fair number of videos through that. But really what got me up and busy was old school word of mouth, but being very purposeful. So I bought a $20 bookshelf off of Craigslist when I started, and I got every single bit of Boston Scientific like promotional material that they had, and I put it like in there so my partners had to walk past it. I used the anatomic model of the erect penis and I fully inflated it, and then I hid and I threw away the modesty cover so that way you got smacked in the face with an implant when you walk by, and everyone's like, oh my gosh, it's the penis shelf, that's Tatum's penis shelf. And I went and I found my partners. I'm like, what do you want to see? You like renal masses? Fantastic. I never want to see another one. Send me all of your pre and post prostatectomy, guys. I gave my partners a reason because I sent them, things that they are interested in. But I also like busted my butt to create, what I think is one of the best prostate cancer survivorship programs, in the nation. We combed through data, found what's the most effective, what has been shown or proven to improve outcomes going into and coming out of radical prostatectomy. I recorded videos educating patients on that. I spent hundreds and hundreds of hours creating, high quality, handouts before ChatGPT was a thing. And I actually created all of that, put it on a website, made QR codes. And I did all of that before I asked for the first referral. I created all of that. And then I came to my partners and said, hey, by the way, I just dedicated the past 6 months of my life to creating this. This is a resource for you and a resource for our patients. And so, as a result, my oncology partners don't have to worry about, talking when it comes to incontinence or erectile dysfunction. They're like, hey, I'm going to take out the prostate. I'm going to cure your cancer. All right. And then you go talk to Tatum. And they see me ahead of time. They see Kristen ahead of time. They get all of that. But so that's how I built the practice. But shortly after that, I was like, oh my gosh, this has worked too well. Now I'm drowning. So I encourage all, aspiring young men's health specialists that, you don't have to worry about a market being quote unquote saturated. You don't have to worry about, there not being enough business. I mean, we are not even getting close to treating all the men out there that desperately need our help. You just have to let them know you're there.
No, that's excellent. And I mean, I don't want to say anything against men's health, but I mean, that approach to just putting your name out there, doing your time, I mean, it applies to anybody. I mean, not just in men's health, but yeah, definitely you need to do that. I did it, and a lot of people has done it. So it's very important to just take your time and go out there, and word of mouth that you mentioned, it really is the way to go when you want to build practice. So Alex, I mean, in terms of, I mean, you have created this huge program, and it's getting bigger. You talk about what you envision in the future. I mean, are you thinking eventually 5, 10 partners? What are you thinking for the future?
Right now, what I envision is, adding, several more APPs, bringing on an MD partner, when the time is right, when the candidate is right, because I would rather keep our team small but extremely dedicated and committed to each other, and rather than just hire somebody because they threw in an application. Kind of the next version of this is trying to scale it, nationwide. And so, we're actually partners with a larger private equity platform, which, that can be a scary thing, private equity. And I've had many friends who have had, experiences that have not been as positive as mine. We've really, really enjoyed collaborating with our PE platform. And so I also serve as the corporate director of men's health for US Urology Partners, which is our PE platform backed by NMS Capital. And I've had an opportunity to help a lot of my colleagues, grow their men's health practices in Ohio, New York, Boston, and we're continuing to collaborate and offer our prostate cancer survivorship program at these other practices. So I think, obviously we can continue to grow and put everything we have in here locally. I am going to hopefully start an MD fellowship, here in the next 2 to 3 years. But on a national level, we're seeking to, franchise this model and empower, other urologists, men's health advocates at their practices to, build up their own programs.
And as you get busier with IPPs, I mean, how can you continue doing the other stuff of men's health? I mean, it's always a balance between, I mean, you mentioned the Tessa that you're going to have tomorrow. How do you keep that balance?
Ultimately it takes a team, because, if you want to do, let's say, 500 implants a year, then, well, you don't have much time for a lot else. And, as of right now, it's a 3-4 month wait to get in to see me for all the pathology, which includes, Peyronie's disease, male infertility, stress urinary incontinence. So, we need more bandwidth. We need more providers. I need more MD providers. I need partners, MD partners who can come, join. But like I mentioned to you a moment ago, I'm very, very proud of the team that we have and of the culture that we have. And so I'm very, very protective of it. And I want to make sure that anyone that we bring on, especially an MD partner, is going to, really be that, that leader and that resource for everyone and a team player.
And Kristen, how about you? I mean, in terms of the future, you as a PA, how do we as providers, as urologists, keep you from not getting bored and say, hey, so it's time for me to go someplace else? I mean, definitely from what it sounds, Dr. Tatem is doing everything that he can to keep you there. But definitely how you continue to keep yourself engaged.
Well, Jose, before she answers, we have to celebrate, one special thing. One more anchor keeping Kristen in the state of Indiana is she got engaged to her fiance, who's an Indiana boy, this past weekend. So
that's good.
Kristen flashed the ring. I can see that thing even with...
Yeah, that's one thing that's helpful.
Yeah, I was about to say, I spoke with her today and I was like, I'm so happy for you guys. He didn't want to, he's a homeboy, right? Like all his family's here, right? He's never going to move. Fantastic.
No, I'm very thankful for the work life that I've found. And it's just helpful to work with people who care, how you feel on a day-to-day basis. And I mean, it's still work, right? Like you still go to a job. So it's not to say that every day is rainbows and butterflies or anything, right? And you have to be realistic about that. But no, Dr. Tatum will definitely do check-ins and be like, how are things? How are you feeling? What are you liking? What are you not liking? And again, it sounds simple, but that means a lot as just like, oh, okay, you care. Can we have, some discussion sessions where we talk about what's working and what's not, and just being open to hearing those things, or open to coming up with solutions, or listening to what your APP, is interested in. So honestly, I think it's just that simple, just having open and honest discussions about how things are going. It's so easy to get caught up in your own stuff day to day, but if you want things to keep running, you have to tend to that machine too.
I mean, there's a lot of things that you could try to write down, Jose, as far as check boxes of how to be a good collaborator. But I think it really comes down to like, you have to truly care. Like you have to, like what makes me and Kristen good teammates is we're passionate about the same thing. We're passionate about men's health. We're passionate about these patients. What keeps us, as collaborators? Well, I mean, like, we're friends. Like I want her to do well. I want her to succeed and, be fulfilled, in her job. And so like, yeah, of course. Like, could you imagine not asking like someone that you care about, like as a friend, like, hey, how you doing? Like, did you enjoy this, or is this working out for you? Or, are like, hey, you seem a little like run ragged, is that my fault? Or, what's going on?
Yes.
Thank you. Yes. And so, I mean, those are just natural conclusions because at the core, like you care about that person. And so, I think that we have to have empathy for our patients and for what they're going through, but we also have to have empathy for our colleagues and our coworkers.
Yeah, excellent.
And it goes both ways. Working with physicians or surgeons, you guys aren't robots, right? You have good days and bad days and tough days. So on our end, it also takes that understanding that things aren't perfect. And, we joke about like maybe someday going to platonic couples counseling, because it's like you have to be able to work together and deal with, tough stuff too.
Yeah. And that includes like, I will tell you one of the biggest challenges that I have faced is when you work closely with someone like this, it really holds up a mirror to yourself. And that's kind of hard to look at. Like one thing I had to come to terms with is that I was nowhere near as compassionate or as I thought I was when it came to me being a teacher. Because when I first started to try and teach Kristen, I just reverted back to how I was taught in residency, which, I mean, that's why I'm in therapy now, right? Like, the staff throws something, yells at you a little bit, questions your worth of your existence. And I'm like, oh, that's how people show love, right? Right, of course. But, that's not normal. That's not healthy. And, I don't think I'm not so damaged as to do that. But it definitely, like, I had to think, like, okay, well, like, how does this person learn? Like, and, what feedback is helpful and how can I deliver it versus like what is not helpful? Like, and that has had to be some hard conversations where, Kristen has had to, like she said earlier, she learned to speak up for herself. She's had to do that to me. Like, hey, like you could have done this better. And, that on my end, I have to learn to take that feedback and be like, you know what? I got to eat humble pie. You're right. And I'm sorry. Can you forgive me? Wonderful. Let's go do the next case.
So Kristen taught you how to do Triaflex?
Yes.
Because I mean, from what it sounds, you were doing it before when Alex was still in residency. So
I swear to God, Jose, she used a chair and she got eye level with the penis. I mean, she got so close to it, it was an HR violation.
Why are you speaking past tense? This still happens.
So
And I tell people, get comfortable.
I'm like, oh my gosh, you can feel your breath on it. Like, God, like she's going to get right in that black, man. It is like a laser.
Yeah. But you know what? That's like a good point, kind of tying that in too, is like me coming here. Sure, I had experience, but you never know everything. And I had to also be open to learning new things. And I will also be the first one to say, though, I will never be cocky in at any point in time in my life, because especially in medicine, that's when you will quickly get humbled, right? Because something will happen, something will come up. So, there's definitely a difference between cocky and confident, and I could still work on the confidence most days, but you have to be open to learning new things in different ways. So yeah, I had a lot of experience with injections before I came, but there's still been times where he'll teach me a thing or two, and probably the other way around too, that I teach him some things. But yeah, you just have to be open to that.
Alex, anything else you want to add?
I just want to brag on Kristen for a second. I mean, she is such a natural in the operating room and with patients. And I have, truly, been blessed to have her, be a collaborator and a colleague and a friend. And, she went from, again, having a lot of experience, doing injections, but hadn't been in the operating room since, she was in PA school. And then she started operating with me. And, honestly, Jose, there have been days where we've done this, where Kristen has independently done all the key moves for, putting in an implant, putting in a malleable, and doing, a sling. And then, in the same patients that she has then gone on to counsel and take care of afterwards and celebrate with. And I remember that moment when I was starting practice, when I, for the first time, saw patients through the whole experience, counseling, case, success afterwards, and that being a real big light bulb moment for me. And to see that happen in, a friend and our colleague who may have not got that opportunity otherwise, that is just as, if not even more gratifying to me than doing however many cases in a year. It's more gratifying than being invited to give any talk at SMS and that sort of thing, to see that fire and that excitement, and then to see her go and pass that on to other trainees that come through, and, to China, who's joined us. That is really cool. I joke that, if I could, model, myself after anyone in entertainment or the entertainment world, I want to be Jon Stewart. I want to be the smart ass who's just sitting there making jokes, but everyone that you've had a chance to work with has gone on and done really amazing things that even eclipse your own. But it's okay. Kristen will be given the keynote speech at SMSNA one year, and I'll be the smart ass in the background, in the back, row, making jokes.
Anything else you want to add, Kristen, to that? I think Alex covered everything, but go ahead and try to top that.
Yeah. Like he said, though, it's really nice just continuing to pass that on to other people too, and seeing other people, succeed. And, especially China, during her own procedures recently and everything now. It's a long journey to get there, but it's really cool seeing that happen for sure.
Good. Well, thank you guys. Thanks for sharing all your input and essentially what you have been doing in your practice. Hope for the best for you guys, and thanks again.
Thanks, Jose.
Thank you so much.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _BackTable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.